Sorry for the interruption, sir.
Okay.
Some network issue. Just a second, sir. I once again welcome all the participants. Sorry for the technical error happened. I would like to welcome Dr. Jose Isaac, sir. He is also the visiting professor from Friendship University, Moscow, Russia. He was also the former chairman of Finance Committee of CCH, Committee for Excellence in Homeopathic Education from CCH, Government of India, also Board of Studies in Homeopathy from University of Kerala. He has also worked as a former member of Education of Committee of CCH, Department of Ayush, Government of India, and also the Faculty of Homeopathy and Professor and HOD of KHMA TRIVANDRUM. At present, he is also the chairman of Postgraduate Boards of Studies from University of Kerala. With a humongous experience and knowledge, today he is sharing his knowledge about the current pandemic situation and the role of homeopathy in the present situation. So I would like to welcome Dr. Jose Isaac, sir. Over to you, sir. You can take on the session.
First of all, let me thank the Karnataka Homoeopathic Medical Association, its president, Dr. Ved Brahmachari, who was an associate of me in the Central Council of Homeopathy, and also all the members of the KHMA for giving me this opportunity. We all know that COVID-19 started in 2019, December, in China, and the first case was reported in India by the end of January 2020. So this was raging over the world for the last 2 years. There are many things to learn from this epidemic because we have seen in the last 20 years, 2 decades, many epidemics, pandemics like H1N1, etc., etc. All were viral diseases. We have seen bird flu, pig flu, then chikungunya, dengue, all in the last 2 decades. One common feature which we see here is it's all viral diseases. And there is no known antiviral treatment in many systems or other systems of medicine. The basic problem was all the treatments were based on identifying the virus, then finding out a vaccine, then some treatment methods. All these were going on. But as you all know, homeopathy was against this method of finding or locating a virus and killing it and making the world safe. One viral disease will be coming in the next few years, the coming years. It's mainly because of the viruses are undergoing mutation. And we all know that killing the virus or suppressing a virus is not the answer. Once you kill a virus or try to kill a virus, it will undergo mutation. It will, and the mutant variant
You can continue, sir.
or the near future also. Now we are facing problems from Corona or COVID-19, and already it has around 15 variants. But the main variants which we have seen here is COVID-19, Delta, and Omicron. So these are the three main variants which cause many deaths. And Omicron, although the number of deaths are less, it is spreading like anything. So here there should be a thinking or a paradigm shift on how to combat viral diseases. There is no antiviral treatment. And you all know that all the 5 medicines used so far in modern medicine was later withdrawn, or WHO has requested to withdraw these medicines or not to, they gave the direction not to use these medicines. In all these, there are many things to learn. The main thing is hydroxychloroquine, plasma therapy, remedies, all those things actually was trying to suppress the viral fever, and it caused many complications and death. So if when the next problem comes, what we should do is a big thing to think about. Because there are 2 methods to deal with the viral or bacterial diseases. One, the dominant system of medicine is using is to kill the virus or the bacteria. But that is not going to be a solution, as is proven in this epidemic or pandemic. So what we have to learn is, we have to give medicines that can improve the immunity of the individuals. That's why when this virus came, throughout the world, people started thinking about the general immunity and how to improve this general immunity. Many times the suppression led to pneumonia. First time when we hear about this COVID-19, what we have seen is the complication was mainly pneumonia. Then thrombosis was the complication. Like that, the complications also changed depending on the medicines used. And nowadays we see some other types of complications, and anoxia was one of the complications, and which caused death. So the complication of suppression of viruses were different when they used different medicines. At one point of time, what we have seen here in India is the deaths were caused by the fungus, or when the steroids was used, many deaths were caused by fungal infections or mucormycosis. But now the steroids have stopped and the fungal deaths also stopped. There are ample proof that suppression led to these things and death. And now people are asked to take the normal fever medicines, and the percentage of death is coming down and down and down. So when we look into this all, what we can find is we need a paradigm shift in the treatment of viral diseases. And as Strauss has said, human beings should learn to live in harmony with viruses and bacteria. And it is not possible by killing the bacteria or virus. So enhancing the immune power only can help us from the coming epidemics or pandemics. So that shows that what homeopathy was saying was found to be true. We were all all the way we were saying that from the beginning of homeopathy, Hanuman was saying that going after the bacteria or virus or parasite or killing them is not the solution. Instead of killing the parasites or bacteria or viruses which cause diseases, so the only way to combat the epidemics or pandemics is to improve the general immunity of the human beings. Because when new viruses come, it is very difficult of not only this epidemic, but the coming ones also. This is, and what should be our approach? Now, we all know that what we see now is the common symptoms of corona is fevers, dry cough, weakness, breathlessness, sore throat, headache, nausea, vomiting, and malaise, nasal congestion, chill, diarrhea, and loss. These are the common symptoms which we see in patients now. And we all know that it's all part of a flu. And in homeopathic materia medica repertory and everything, we can find a lot of flu medicines. And these flu medicines are found to be useful in our practice in this epidemic also, just like any other epidemic. Because the symptoms which we see are almost the same. The only thing is these combinations differ. And as in every epidemic, although there are common symptoms, there will be some symptoms which will stand above the other symptoms, or there will be some symptom which is seen in individuals more or more severely, depending on their individual variations or constitutions. So some people will have severe weakness, some people have severe breathlessness, and some people even started with the diarrhea, nasal congestion, or sometimes like that. The symptom combinations varies from individual to individual. And that is the reason why we need different medicines in corona also, depending on the constitution and individuality of the patient. So what we have seen is there are three phases or three things which we have to come across or we have to deal with now in corona. The first one is many people are coming to us with saying that they are RT-PCR positive, that is the patients. Another group is people who are having post-COVID syndrome. And lately, now we see people coming after vaccination with some symptoms. So now we are treating or seeing patients of these three different types, the infected ones, then the post-COVID syndrome, and complications of vaccinations. So this is the area where we have to concentrate. And one of the major things we have seen is 70% of the people now are coming after vaccinations. And in the beginning, what we have seen is more deaths were reported in people who were taking some immunodepressant medicines, and more death was reported among the people who have chronic diseases for a long time. And 75% of the deaths were above 60%. So it was more affecting the older age group, and the children were mostly free from it. And the death was due to pneumonia, oxygen depletion, thrombosis, organ failure, and fungus infections. So here, the problem here we see is we have to be very careful when we treat these asthmatic patients, patients who have high blood pressure, patients who are diabetic mellitus, and chronic obstructive pulmonary diseases. Why I say this is many times patients come and take medicines from us, and they think that this will be enough until the whole episode is finished. But people who have diabetes, hypertension, or pulmonary diseases, asthmatic conditions, all, the first thing we have to do is tell them to report every day. Because in acute diseases, the symptoms changes and changes in a very fast way. And then we have also sometimes we have to change the medicines also. Then all the general measures which were said by the government and everywhere, I'm not going into that. So that it is better to follow the general measures. But now we know that the general measures, many of the general measures which were adopted by the, or which the governments recommended, are found useless. Then another important thing is the remedies for coronavirus. Here, we know that in our Remedies or repertory or in therapeutics or anywhere, you won't find any specific remedies for Corona-19 or COVID-19. But this is a flu, it's an influenza. And so basically what we have to do is all the medicines which we were using for influenza or flu can be used in this epidemic also, or pandemic also. As you know, as you all of you know, the main flu remedies which are given or 125 years is belladonna, ferrophos, in the initial stages or in the beginning, before the symptoms are very clear. And in the second stage, when the disease, the symptoms are more clear, the medicines used are arsenic album, bryonia, prostox, pulsatilla, nexomica, phosphorus, etc. Then on the third stage, when the fever comes down or something like that, we find we find other remedies in the third stage of flu very useful. So what I mean to say is, in my experience, initially I was giving arsenic album as the preventive, and as our Central Council for Research has recommended. And now I find more effective remedy now is bryonia. Maybe it is because the climate has changed and we have the hot days and cold nights. And maybe that's the reason why bryonia became a better remedy now in Kerala, in my day-to-day practice. Because almost 20-25 patients I see with corona every day, especially when this Omicron came. When one member of a family is infected, in the next few days, the others are also infected and they also get fever. So here, one more thing is, we all know that there are common symptoms of corona, and our prescription is not based on the common symptoms, but on the symptoms which are individualizing the patient. That means some people have severe headache, and if they come with a severe headache, we usually give gelsemium or bryonia. And the most effective one I have seen is giving the 200 potency 4 times a day, 1 pill, and watching the patient, or you can even they can contact us through the phone and report every day. In some cases, we see it starts with severe weakness, and in severe weakness in an acute disease, the main remedy is arsenic album. And another important thing is in some people it starts with severe chill, and if severe chill is there, gelsemium and Restox are the remedies. Then another thing is in some cases we see diarrhea or gastrointestinal symptoms, and there we start with an Exomica. And if nausea is predominant, we start with Ipecac. Then another remedy which we have seen is some of my patients in Switzerland, they have used, they were phosphorus, and phosphorus was found to be very useful, especially in the beginning stages when many people died of pneumonia. Another remedy is, in some cases, the fever starts with breathlessness, and the remedies found useful are Antimonium tartaricum, tuberculinum, arsenic album. Some cases we see the inspiration is difficult, and if inspiration is difficult, the remedy is spongia. And if expiration difficult, the remedy found useful is causticum. In some cases, we see the fever starting with the sore throat, because nowadays, after this Omicron came, many children got this flu starting with a sore throat. The main remedy is Restox and Heparsil. Then some people say that they have a feeling of weight in the chest, and the remedies found useful are phosphorus and bryonia. Then another group says that it starts with a cough, and the main remedies are sanguinaria, bryonia, and phosphorus. In some people, we see the starting with fever, starting with backache, or backache is predominant, and then the Rustox 200 is found useful. And people who have the fever with bone pains, Eupatorium perfoliatum is found useful. And some people have severe lameness or weakness, and even arnica worked very well. In some patients, we see fever with the constipation, and the remedy found useful are bryonia and nexomica. In some patients, even after giving the indicated remedy, the fever is not coming down in a big way or continuing for 2 or 3 days. Then the remedies are sulfur 200 or sulfur vannam or tuberculinum 200 or tuberculinum vannam. Actually, maybe it is due to the tubercular myasm, which is active in them, or soaring myasm, which is active in them. Then some patients come with great thirst, and the main remedies are bryonia, arsenic, and phosphorus. After this fevers, in the beginning, when COVID-19 was the main, or Delta virus was there, many of my cases took 3 days to get a cure. But Omicron is more easier and goes off in 2 days. But in the beginning, many people had severe weakness after the corona infection. And the remedies which are found most useful was carbovage and sulfur, which are the remedies to be given after acute diseases for a complete recovery. In some cases, we saw fibrosis of the lung because some people, they go to allopathic hospitals and come back and says that they have found that fibrosis of lungs is there. And in such conditions, we see some kind of restricted chest movements, and calimore, bryonia, phosphorus, calicarb, tuberculinum are found useful. And in post-COVID syndrome, we see many patients who had chronic diseases, it gets very much aggravated. So that's the reason why I told you from the beginning, every day we have to get a report from the patient and see whether it is going in the wrong way or wrong direction. And if the symptoms changes or if complications develop, we have to change our remedy also. Here, post-COVID syndrome, many people have a loss of appetite, and in such condition, carbovage worked well. In some people, we have seen loss of smell, and for loss of smell, my best the remedy which I found useful in my patients are pulsatilla and nitric acid. Also, some people have severe weakness, lameness, arnica, even arsenic, and carbovage. These are the 3 remedies found used. Then there are people who are having cough as a post-COVID syndrome, and sanguinaria worked very well. Sanguinaria can, especially when the cough is in the evening or at night. And also remedies found useful are even bryonia found useful, arsenic calb also, because many people had a cough as a post-COVID syndrome. In some people, we have seen gastric complaints also. So these are the remedies which are found useful. But now, in the last 2 months, we are getting patients who are taken the vaccination and coming with some complications of vaccines. Here, the main remedies, as all of you know, for vaccination effects or side effects of vaccination, the thuja, silesia, antimonium tart, meserium, etc. Out of this, thuja was found most useful, maybe because this is a viral disease also, so it was better than other remedies. But when we see some, neurological disorders or neurological complications, the best remedy is finally silesia. And some people even come with severe pain on the arm where they took the vaccination, and magnesia force 30 or 200 worked very well. Then many patients who had diabetes, the blood sugar shoot up, and the medicine found useful is Nexomica, lycopodium. I think I have covered almost all the things which I was doing for the last 2 years, and mostly I was using polycrust remedies, and that is one of the advantages in any epidemic, because polycrust remedies covers known and unknown symptoms, and also it has a deeper and wider action. And 200 potency was found most useful. So I think my time is over. 40 minutes was allowed to me. And thank you all for the patient hearing, and also KHMA. Thank you. If you have any questions, I am ready to answer.
Thank you, sir. Thank you for the huge experience you have shared with us. I feel it is very useful at this moment for the budding practitioners as well as the experienced practitioners to know about the different aspect of COVID, post-COVID syndrome, post-vaccination effect, as well as the active COVID symptoms too. If any questions, I request the participants to put it over on the chat box so that I'll convey it to sir. And we have a maximum 3 minutes time so that we can conclude with the discussion part. Any questions? You can post it on the chat box. I think there's no questions, sir. The participants have understood it clearly. I feel you have made it very clear so that there is no doubts to be or questions to be asked by the participants. It was really a thought-provoking session, sir. We would be looking forward to further more sessions as such in different on different topics too. Thank you for being a part of our KHMA share series, sir. Thank you very much. On behalf of team KHMA, I also thank our president, Dr. Veeru Brahmachari, sir, for bringing in you as the speaker for today's session, and also thank the office bearers of KHMA for attending today's session. And if any other suggestions or any other programs to be done, we would accept your suggestions. It is free. You can put it on the chat box. Thank you all. Have a good day. Thank you very much. Thank you, sir.
Thank you.
The recorded version will be available on our channel, YouTube channel, very soon. Once the editing part will be done, and it will be uploaded very soon. Thank you very much.